This topic is complicated grief disorder or bereavement.
Okay, yeah. So complicated grief disorder. What has to do with grief? Of course. Next slide. Okay, so the normal. These are the normal stages of grief after the loss of a loved one, or after a loss of a loved one. People usually go through these 5 stages: denial, and then anger, and then depression, bargaining, and then acceptance. These are normal for every human being that goes through grief on the normal basis. But what we want to talk about in particular is when this grief is uncontrollable. Like usually it's you get to the acceptance stage and then you live and you move on. Some people don't live through the acceptance stage. They get stuck in the the stages before it. Next slide. Okay, so losing a loved one is one of the most distressing and unfortunately common experiences people face. Most people experiencing normal grief and bereavement have a period of sorrow, numbness, and even guilt and anger. Gradually, these feelings ease, and it's possible to accept loss and move forward. So, normal people move forward after the loss. For some people, feeling of loss are debilitating and do not improve even after time passes. This is known as complicated grief, sometimes called persistent complex bereavement disorder. In complicated grief, painful emotions are so long-lasting and severe that you have trouble recovering from the loss and resuming your life. So, in the stages of grief, there's the stage of depression. And what happens during complicated grief disorder is this stage of depression is long-lasting, it never goes away. And after that, he needs to get medical attention of his condition. So why does this happen? Why can't people move on from this experiences? Well, your brain is trying to, what happens during grief is that there's a deep biological response to your loss. You're afraid of this moment that it's going to happen so much that when it does happen, your brain is trying to recover. Your brain goes through a biological response that's deep, and if it's deep enough, it's hard to recover from. Just as you are experiencing physical, psychological, and emotional responses. So your brain is trying to process everything that's going on, especially that this is the moment that you're afraid that's going to happen. Hormones and chemicals are released, internal reactions are disrupted, important bodily system shifts into emergency mode, and it all starts in the brain. So this emergency mode, like all of your life, you're trying to get away from this moment, and when this moment happens, your brain just freezes, just goes into emergency mode, as it says in the slide. Next slide. Okay, so what happens in your brain during grief? The prefrontal cortex, the thinking center of the brain. This part is the one that's mainly like the part of the brain that's responsible for thinking, and thinking is underactive. And the interior cingulate cortex, the emotional part, is underactive. The emotional regulation, so you can't regulate your emotions. And the amygdala, the fear response, is overactive. So this could put into perspective what's exactly going on in the brain. It's just the fear response is way too high. Next slide. Guys, if you have any questions, don't be afraid to stop me. The prefrontal cortex, as I said, is the area. The functions of this area include the ability to find meaning, planning, self-control, and self-expression. Brain scans shows that loss and grief traumas can significantly impact your emotional and physical processes. So when you're going through grief, this self-control, self-expression that the prefrontal cortex has, it decreases dramatically. Articulation and appropriate expressions of feelings or desires may become difficult and exhausting. Okay, yeah. So the thinking center starts to become underactive. Next slide. The limbic system. This is the emotional part of the brain. Is in charge of personal recall, emotions, and memory integration, attention, and your ability to take interest in others. During grief, it creates a sensory-oriented protective response to your loss. So the fear response, especially in the amygdala, it becomes too high, and in that you get really anxious. You may experience a strong instinctual or physical response to trigger that reminds you of your loss. So it's just a fear response that reminds you of the loss all the time. That's why it's really hard to get out of your head in grief disorder. The parasympathetic nervous system, the CGD. So in grief, most of the time, the people undergoing the grief don't like to eat. They have heavy breathing, and that's due to the parasympathetic nervous system. The system is in charge that connects your brain to your digestive system, and the low and breathing, digestion, and may sort out your breath. So it becomes underactive, so your short becomes breath, and your appetite disappears. You don't want to eat. It becomes underactive because the fear response is too high again. Yeah, I think that's it. Short shower becomes in sleep disturbance or insomnia becomes an issue. You guys, any questions before I?
Symptoms include intense sorrow, pain, and rumination over the loss of your loved one. You focus on little things and focus mostly on your loved one's death. Extreme focus on reminders of the loved one or excessive avoidance of reminders. Intense and persistent longing or pining for the deceased. Problems accepting the death. Numbness or detachment. Bitterness about your loss. Feeling that life holds no meaning or purpose. Lack of trust in others. Inability to enjoy life or think back on positive experiences with your loved one. Without appropriate treatment, complications happen. Complicated grief disorder can make you physically, socially, and mentally ill. Complications include depression, suicidal thoughts or behaviors, anxiety, including post-traumatic stress disorder, significant sleep disturbances, increased risk of physical illness such as heart disease, cancer, or high blood pressure, long-term difficulty with daily living, relationships or work activities, alcohol, nicotine use, or substance misuse. One of the preventions is talking. Talking about grief and allowing yourself to cry can prevent you from getting stuck in complicated grief disorder. Your pain will start to lift off if you allow yourself to feel it. Support. Family members, friends, social support groups, and your faith community are all good options to help you work through your grief. You may be able to find a support group focused on a particular type of loss, such as the death of a spouse or a child. Bereavement or complicated grief disorder counseling. Early counseling after a loss is a good way to cope with this disorder. This may prevent negative thoughts and beliefs from getting such a strong hold, and they're difficult to overcome. Educational therapy and learn about the disorder can let you go away from it and redefine your life goals. Hold imagined conversations with your loved one and detail the circumstances of the death to help you become less distressed by images and thoughts of your loved one. Explore and process thoughts and emotions, improve coping skills, reduce feeling of blame and guilt. These strategies may help you cope with the disorder. Stick to your treatment plan, attend therapy appointments, and practice skills learned in therapy. Take medications as directed by your therapist. Practice stress management. Unmanaged stress can lead to depression, overeating, or other unhealthy thoughts and behavior. Take care of yourself. Get enough rest by sleeping well or by not over-energize yourself. Eat a healthy diet. Exercise regularly because it can relieve stress, depression, and anxiety. Don't use drugs as a relief. Reach out to your faith community. Pray a lot and follow your religious belief because it can give you comfort. Socialize, stay connected with your friends and family. They can offer support, a shoulder to cry on, or a shared laughter to give you a little boost. Plan ahead for special dates or anniversaries. Prepare for a productive weekend or holidays, anniversaries, and special occasions. Celebrate positively or acknowledge your loved one that provide you comfort and hope. Learn new skills. Learn to cook, for example, or finances. Ask family, friends, or professionals for guidance. Seek out community classes and resources to learn more. Join a support group. Over time, after your loss of loved one, you may find shared experience comforting, and you may form meaningful new relationships. Here is the end of the presentation. Thanks for the attention.